there! Hi everybody! Hello nurses and hello world! This is nurseniezl and welcome back to my channel. This video is solely for demonstration purposes only, as interpreted by the actor based on her understanding of the specific skill with reference to the Royal Marsden 10th edition. All information presented are public domain materials accessible to the relevant governing organization's websites. Subtle similitude may be noticeable, however, this is not intended to be definitive guide to the NMC Part 2 Test of Competence or the OSCE examination. This can be helpful materials for overseas nurses or internationally educated nurses to learn and adapt to the UK clinical setting and transition effectively into practice. We have now come to the last station of subdural hematoma. This is evaluation station. If you hadn't seen the assessment, planning, and implementation station regarding subdural hematoma, please click the link below. Or go to my channel, nurseniezl playlist, and watch all the OSCE videos available for you. Evaluation station is a combination of writing and verbalizing, handing over the patient. However, your documentation doesn't matter except for the documenting your name on the front page. What matters here is how are you gonna hand over to your examiner, okay? If you want an in-depth learning regarding evaluation, you can head on to my channel. There's a nurseniezl playlist in there and find evaluation station. Again, candidates, remember you only have 8 minutes to complete this station. And before we head into it, give this video a like and subscribe to my channel. Also, if you want to get notified just in case I post more OSCE videos, then hit the notification bell. Read the scenario carefully. Remember, candidates need to hand over or escalate using S-bar. Candidates can make notes on evaluation sheet to support answers. However, these notes will not be marked. Candidates need to finish the escalation within 8 minutes, and that includes the note-taking or the writing part.
Hello.
Hi!
Welcome to your evaluation station. You've got 8 minutes to complete this station. Here is your evaluation paper.
Thank you.
So you have your assessment paper here, planning, and implementation.
Okay, thank you very much.
Thank you.
Okay. So for a complete guide for doing your evaluation, you can head on to nurseniezl playlist and look for evaluation station. There's a complete guide there on how are you gonna write and then verbalize your answer to your examiner. By the way, nurses, you have to make sure to stick on the marking criteria. This is the test of competence marking criteria. You can find it in the nmc.org.uk, alright? Before I start writing, I will let you to read the scenario carefully. So this is from the first and the second page. Candidates, it is a good practice to structure your thoughts and put it into writing, so it will be easier for you to hand over systematically. Manage your time. Spend maximum of 3 to 4 minutes in writing or structuring your thoughts and then at least 4 minutes to verbally hand over your patient. Remember, candidates, writing will not be marked. It will all depend on you and how you're gonna hand over your patient to your examiner. For the situation, hi, I'm Nizel Consina. I am the nurse looking after this patient that I'm about to hand over here in the general ward. Am I speaking to the doctor overseeing the patient's care?
Yes.
Okay, so this patient name is Marina Winters. Date of birth is 1st of the 12th, 1967, with a hospital number MW12345678890. Okay, and she is currently here in our ward, in the general ward. The reason why I'm handing over this patient is because the patient condition is now deteriorating. She is now very confused and agitated with a GCS of 14 out of 15. And like I said, the condition and the obs are already deteriorating at the moment, okay? For the background, the present complaint of the patient is patient is admitted following a fall in the garden, developed head injury and bruises on the left arm and left hip, which is the main reason she attended A&E. She's now admitted here in the general ward and diagnosed with subdural hematoma. Patient seems very disorientated, confused, and anxious. Past medical history, she's got a history of multiple falls since 2 years ago, right neck of femur fracture a year ago, and hypertension. Social history, Marina is a widow and lives alone in a chalet. She's got a cat and she's very worried about her cat care. She wears glasses and hearing aids. She likes reading, listening to music. She used to sing and dance. She is usually independent with ADLs, but because of the fall, now acquiring subdural hematoma. She will require assessment to confirm mobility and will need support. Marina is 5 foot tall and weighs 48 kilograms. She usually eats a normal diet and free fluids. However, due to cerebrovascular accident, she will require thickened fluids, soft diets, and might need a salt referral. She is allergic to penicillin, and allergic reaction would be rashes. Now, from the previous assessment, I got here her neurological observation chart. So, ABCDE pattern. I got her airway here, clear, no visual obstruction, breathing. The RR is 20 BPM. Oxygen saturation is 97 with regular and normal rhythm and depth. Circulation, pulse rate of 77 beats per minute with regular rhythm and normal strength. BP of 120/87 millimeters mercury with capillary refill of less than 2 seconds. She's got normal perfusion and no pallor noted. Oh yeah. Disability, she was slightly confused from the beginning, not agitated at all. Eye opening was a spontaneous motor obeys command. Pupils equally reacted to light. Limbs are, which is 3 reactive. Limbs, she's got a mild weakness on both left arm and left leg. Okay, normal on the right arm and right leg. Okay, urine output is okay. There's no problem with bowel output, and BM was not taken that time. Pain was 7 out of 10 during the assessment. Exposure, she's got bruised left arm and left hip, also back of the head. Temperature is 36.4 degrees Celsius. Currently, airway is clear, breathing, respiratory rate of 26 breaths per minute with equal air entry, normal breath sounds with oxygen saturation of 98% on air. Circulation, BP is 200/100 millimeters mercury, capillary refill time of 2 seconds, less than 2 seconds. Pulse rate is 105 BPM or beats per minute, rapidly and with regular depth. Disability, she is alert, appears more confused and aggressive. Pupils equal and reacting to light with severe weakness on the left arm and left leg. On the other arm, on the right arm and right leg, it's still normal. She's still got GCS of 14 out of 15. Urine output is 230 mL for the last 4 hours. Exposure, we've got here temperature of 37.4 degrees Celsius, bruises on the left elbow, left hip, and back of the head. Okay, so at the moment, the patient is tachycardic, hypertensive, and tachypneic. The urine output is quite low, even if the patient was already given furosemide. And now she's very confused and aggressive as compared the last time during the assessment when she's just slightly confused. She's got severe weakness on the left arm and left leg, which is different from the mild weakness that she was having during the assessment. So what I did is I've done the repositioning. I've given her analgesia for the pain as well. I've given furosemide for her and antihypertensive tablet. Unfortunately, the blood pressure remains high. My recommendation is if you could just please see the patient. She needs a further management since the patient's GCS remains 14 out of 15 and having severe weakness on left extremities. She might need CT scan, MRI, and further blood test. Can you also please prescribe antibiotic as the patient is allergic to penicillin and she is currently prescribed with amoxicillin, which is a penicillin derivative. Can you also please adjust the paracetamol as the patient is only weighing 48 kilograms and she is currently prescribed with 1 gram paracetamol. Can you also please prescribe any medication for her high blood pressure as it is increasing at the moment? Can we also refer the patient to the neuro team for further management? At the moment, I will monitor the patient every 15 minutes until stable. Is there anything else that you want me to do while waiting for you?
Just continue monitoring the patient and I'll be on my way. I will also bleep the neuro team.
Okay, doctor.
Thank you. Thank you.
And that's the end of evaluation station. I hope you learned something for today. Thank you so much, Nurse Jenny, for joining us today.
My pleasure.
Okay, hopefully we'll be seeing her a lot more times in this channel. Thank you so much for your help for today. I hope you really learned something for today. And if you like this video, give this video a like and subscribe to my channel. Also, if you want to get notified just in case I post more OSCE videos, then hit the notification bell. If you want to become a member, please click the join button because if you got a question for me, it will be pop up to the top and I'll be able to see it as soon as I can and reply as soon as I can. Okay? This has been nurseniezl
And Nurse Jenny.
See you on the next one. Bye! Finally, it's shout out time. So I would like to greet congratulations to at Hasana as Maubelo 3540. Congratulations for passing your exam. Thank you for loving my channel at Papi Ted ZZ5BR. Salamat at mabuhay din at preparation for OSCE Junior 4 me. Welcome to the team at Sport City 7561.